Okay, welcome everybody to this webinar on Thriving Together, a collective impact project designed specifically to protect children, promote their health and realise their potential. My name's Eugene McGarrell and I'm CEO of Healthy Australia, and also with me is David Salajan, who's CEO of Hub Hello. Hi, David.
Hey.
So Thriving Together emerged from feedback we received from the early childhood education and care sector, really at the onset of COVID-19 and the pandemic. There were concerns raised by educators that the lockdown would place more children at risk and that the sector was not equipped to respond to that risk as they were being identified. Before we get into the webinar, I would like to acknowledge the land on which I'm hosting the event from today. That's the land of the Gadigal people of the Eora Nation. And I wish to pay my respects to elders past, present and emerging, and to any Aboriginal people that might be on the call tonight. So I'm going to share my screen now, see how this goes. Okay. Now, is that up?
It's yes.
Can you see the screen? Okay. So Healthy Australia is a small charity working predominantly in the early childhood education and care sector. We have partnered with the Australian government to place tools in the sector that protect children, promote their health and realise their potential. These tools include Protect, which is a program designed specifically to identify children at risk of abuse and neglect. Feed Australia, a program that supports the sector to prepare healthy meals for children, and Educate, a program that engages parents in the learning journey of their child. So that's really in effect what we do. Thriving Together, though, is a collective initiative between several organisations, including the Child Abuse Prevention Service, or CAPS, New Schools and Arts Neighbourhood House, which is a neighbourhood centre in South Grafton and an early childhood service. Primary Care and Community Services, which run primary care services, including social prescribing, and Hub Hello, which is a tech company that David is CEO of. The Waratah Education Foundation was funded, has funded the initial programme, and FAMS has been engaged to evaluate that programme. Supporting partners include the North Coast Primary Health Network, the North Coast Collective, and Local Health District's first 2,000 Days programme. So we've been working with the sector and local providers in South Grafton and in the Clarence Valley. Thriving Together itself is at the prototype stage. This means we will be setting up a programme for a handful of families to see what works and what does not work. The prototype will run for 8 weeks from the first week of September in South Grafton. So we're hoping then by November to have a report on what works and what doesn't work. And the 8-week prototype stage will take the lessons and we'll apply those lessons to a pilot program. The aim of the initiative is to prevent adverse childhood experiences and to promote resilience to adverse childhood experiences. So we're looking at preventing what's called ACEs, or adverse childhood experiences, and also to build resilience for families that do experience those ACEs. By achieving this aim, we believe we can improve lifelong health, social and economic outcomes for preschool children. So I'm just going to talk a little bit about what ACEs are, or adverse childhood experiences, and I've got an infographic there from the Anne-Marie project, which really sort of goes into some of the details there. The CDC Kaiser Parmente Adverse Childhood Experience Study is one of the largest investigations of childhood abuse and neglect and household challenges and later life health and well-being. So we'll just dive into that. So the infographic that's been produced there by the Anne-Marie project shows that there are 3 types of adverse childhood experiences: abuse, neglect, and household challenges. You will notice that there's a link there between the numbers of ACEs and lifelong impacts, including lung disease, liver disease, depression, addiction, and suicide. And some of those figures there, I think some people may find, I mean, I certainly found them interesting, that, you know, if you experience as a child between 0 and 16 at least four or more ACEs, then you're 3 times as likely to have lung disease and likely to be a smoker, that you're 11 times more likely to have intravenous drug abuse in later life, 14 times as likely to have a suicide attempt, and 4 times as likely to have begun an intercourse by the age of 15. So these are significant lifelong events and have a real impact to health. And we believe that by focusing on reducing adverse childhood experiences, that we can have a real impact on the health of children as they become adults. For me, one of the big statements there is that one there from Dr. Robert Bloch, who is the president of the American Academy of Pediatrics, where he says that adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. So I'm just going to dive a little deeper into adverse childhood experiences with this short video. So I'll just play the video. Hopefully that works for everyone. Is there any volume coming from that?
No.
Okay. I think we might have to let that go then if there's no volume. Okay, so we're going to let that go, given that there's no volume from the video. But look, I think it's important for us to realise that this piece of research and the evidence there that's provided shows a real link between adverse childhood events and health and social impacts. What also the research shows is that we can do something about that. And that if we don't do anything about that, then what happens is that families can get into a cycle of poverty. And the cycle here that's provided shows that for people that, you know, low-income families can lead to poorer educational outcomes for children, a difficulty in getting a job, and then poorer overall life outcomes. And that cycle continues. And what we want to do with the Thriving Together project is to break that cycle. And we want to start doing that in South Grafton. Our concern is that the rate of which children will be taken away at the moment from their families and into foster care. So what we do know, and what we've known from data that's come from state governments, is that reports of significant harm of children, they continue to rise, as do the increase in number of children that are taken away from home and into foster care. So we believe that not only will we improve the health of the child as they become adults, but we'll also be able to intervene early in a way that reduces the risk of them ending up in foster care, which, as you know, as most people know, can lead to further stress. We also understand it's not a simple problem to fix. We get that, and this requires an adaptive approach as we operate in a volatile, uncertain, complex, and ambiguous environment, and that's commonly known as a VUCA environment. So at one end, we're saying, okay, we know that children experience adverse events, and we can experience it, and we can do some work to prevent that. But we also can build a resilience for children. But we also appreciate that it's not a simple thing to treat. So we've looked at the Cinephone Framework, which is on the screen now. And we know that if we try and solve a complex issue, which is in the top left-hand corner, by using simple, best practice and obvious solutions, that can often lead to chaos. So what we've got to do is we've got to work in this complex environment in a very emergent way. And to do that, we need to probe, sense, and response. So the prototype that I'm going to explain in a second is really a way of us getting into a community, which is South Grafton, in a way that's able to test some theories and some evidence in a way that is with it doesn't have too much of a risk on anyone in particular, but do in a way that we can see what works and what doesn't work, and be able to then create an emergent process that helps us look for solutions that are best appropriated for children and families at risk. So I did have another video, but I'm not going to show that given that the audio isn't working, except to say that the video really goes on to how do we prevent adverse childhood experiences. So I'll talk a little bit about that now and what are the key strategies for that. So according to the research, and again, this is evidence-based, there are 5 key strategies that we can employ to reduce or prevent adverse childhood experiences. The first is strengthening economic support to families, which in one way is basically saying that let's get families out of poverty, and we can do that in a number of ways. Clearly, as our economy is becoming stressed with the coronavirus, that's going to be more and more difficult for more and more families. So we want to be able to work with governments in a way that can actually look at strengthening economic supports through job keepers and through other economic stimulus. Some other ideas have come through economic modeling like modern monetary theory, which have proposed that we address this issue through something called the federal job guarantee. And there are other proponents of a universal basic income that can also be used to help families get out of poverty. But also, look, we can do that, but we can also look at creating family-friendly workplaces. So particularly women who are not working regular patterns of work, who work in shift work, often childcare becomes very difficult for them, and that then means that they can't be employed. And so creating family-friendly workplaces can also help both parents engage in the economy and in employment. The second area there is to create and promote social norms about parents and positive parenting, looking at how we might engage through public health promotion campaigns that really support and make normal what positive parenting looks like for everybody. And often people are disconnected from economies, are disconnected from community for whatever reason. That might be because of poverty, it might be because of addictions or mental illness or disability. Whatever the reason, I think by really supporting those communities in a way that we're connected and providing support to positive parenting and understanding of the impacts of positive parenting. One of the major issues and strategies which we can employ, and we currently are employing, is providing local good quality early learning. And so the federal government has really invested in this space, and we know that there is quite a significant amount of benefits that go into supporting early learning, early childhood education and care. And we know that children that do go to early learning for 2 years or more are more likely to have fewer adverse childhood experiences and are more likely to be school ready when they're transitioned to primary school. Now, the key thing about this is that 20 to 30% of families don't access these services, and often these are people who are in the poverty trap. And so how do we improve access to those services? And how do we make sure those services are within walking distance of everybody that lives in Australia? Because often some of those services are miles away, kilometres away, and are not really useful for people who are living in some rural and remote communities. The fourth strategy is to enhance parenting skills to promote healthy child development. And that might include looking at early childhood home visitations, where we've got clinicians and practitioners supporting families at an early age, particularly those families at risk, and also looking at parenting skills and family relationship approaches. So there are lots of targeted early intervention programs that are available. Family and community services, I know, provide some of these services. And so improving access to those services is really important. And finally, one of the main strategies is to be able to intervene early when risks are identified. So first of all, how are we identifying risks? And educators were telling us that we can actually are very good at identifying risks, but we don't have the capacity, capability to manage those risks in a way that we can refer to early intervention. So enhancing the primary care sector, looking at behavioural patterns and for service for families, and treating to lessen harms of abuse and neglect. Really, if we can, we want to keep children at home with their families, unless it becomes a significant risk for the child. And of course, child protection services will take over. So look, the Thriving Together collective aims to deliver on these strategies really in the following way. So this is a diagram of how we want to work together, and I have to reinforce that this really is a prototype. We think we've done some work over the last 3 months on looking at the research and the evidence and doing a lot of this work through desktop analysis. But none of this will we don't really know how much of this will work until we test it in the real world. So we've got Hub Hello, Child Abuse Prevention Services, New School of Arts, Neighbourhood Centre, Primary Care and Community Services at the top there, and they're linking throughout the pathway from the child through early childhood, through to peer support and social connections. And each of those agencies will provide a particular number of strategies to test that they can achieve the results that we're looking to achieve. Healthy Australia, which is my organisation, will provide the backbone support, knitting that all together, and FAMS at the top will provide the measurement to see whether we wanted to do what we wanted to do is actually happening. So Hub Hello are looking at a technical solution which will help support particularly the primary parent to access services and to own the data for their child in a way where they can provide access to that data when that data is required, so that the child and the family don't have to retell their story, where they can actually own the data and pull back the data when they want to, but also provide I guess a journey map so that families understand where they can access help and support. The Child and Abuse Prevention Services they'll act as a community coordinator that is responsible for the coordination of services and supports relating to the implementation of the programme. So they're really going to operate in the front end to try and really engage with families and communities and really improve access to the early childhood and education and care sector. The New School of Arts Neighbourhood House, they run early childhood and education as well as a neighbourhood centre, and they're going to knit their services together so they can improve access to peer support. There's nothing better than families working together, particularly when you've got young children, parents working together, mothers working together, fathers working together in a way that they can say, I've got this problem, how did you solve it? And they can really come together, but also they can provide the peer support that's required. And finally, primary care and community services will link with the primary care sector to provide what's called social prescribing. So that's a non-medical way, a non-medical option for GPs and other referrers to connect people, families to local community activity and improve social connections. So that's really sort of the I guess, logic model of what we're aiming to do. So Thriving Together is also looking to seek partners and to connect so that we avoid duplication of effort. We think that we can improve access to early learning for families that are struggling financially, and that we can create intervention options for families that keep children safe, promotes their health and realises their potential. So I'm going to stop sharing and open up, see if there's any questions on anything that I've said, or any questions anybody's got for me and or David. You can use the chat down below to ask. I'll just give it a few minutes, see if anybody has got any questions. There's the Q&A. Sorry, there's the Q&A area that you can ask questions on. No questions?
Oh, here we go.
Great, hang on. Hi, I'm Rachel Gorman from the Healthy North Coast in Clarence. I'm interested in how Grafton became a target area. That's a great question. Well, we run services in a number of early childhood education care services across Australia. I think, is it 6,000 altogether, David?
Just over.
Yeah. We sort of looked at the ecosystem of the localities and on the networks that we already had. Um, I I jumped on a webinar that was being run by Ian Hickey on the mental health work they were doing with the North Coast collective up there, and connected with Julie Sturgis, who's the CEO of the Primary Health Network. And what I got from them was a real sort of understanding that they're really keen on working together. So we just thought the North Coast essentially was a good area where we could come together and connect with the collective work that's already happening. And then we talked to the neighbourhood centres in the North Coast, Julie Williams, Sky and Greta, and we talked to that collaborative that they've got. And they went away and they talked about really hosting this program. And after a couple of weeks, they got back to me and said, yeah, they'd be keen to host it. And then they chose South Grafton. So they chose that as a possible area. And what's useful for South Grafton, of course, is that the New School of Arts Neighbourhood Centre and Neighbourhood House runs early childhood and neighbourhood centres as well. And we were keen to make sure that the neighbourhood centres were locked into this programme, because right across Australia, there's something like 900 neighbourhood centres. I mean, there's more neighbourhood centres than there are McDonald's restaurants. So we wanted to make sure there was an infrastructure. So when we worked out what worked, we were able to scale that in a way that was building on that infrastructure. So yeah, so that's basically, it's a pragmatic approach, and it's linked to our network, and we were invited in.
I've got a follow-on question for that as well from Leonie Staples. Leonie's asked, is Grafton the target area or greater Clarence Valley?
Hi Leonie, how are you? So it's really South Grafton for the prototype, but then we want to widen it to the wider Clarence Valley for the pilot. And knowing that you guys are based in Clarence Valley with the first 2,000 years, we really want to make sure that the first 2,000 days, not years, but that the work that we do is aligned to the work that you guys are doing, so that we can build some partnership and test those links early on. If I'm not answering the question if there's follow-up questions, please ask away. Okay, thank you, Leonie. Jacqueline Noble. So I work in the first 1,000 days as clinical midwifery specialist, working with vulnerable pregnant women through 12 weeks postnatal. How do you work with the first 2,000 day initiative? Yeah, no, I think I've answered that. So we have connected with Leonie. I think we've had maybe 2 conversations, and we're planning to have more. I'm also on a promise to come up in 2 or 3 weeks and sit in the space up there in the first 2,000 days office. I'm not sure what it's called, and to build a relationship there, but also to support the initiative that we're running in South Grafton. So the how will really emerge over time, and it'll be through negotiations and conversations with Leonie and the team. Did that answer your question, Jacqueline? Yeah. Okay, I'm assuming yes. Thank you. And thank you, Rachel. So great, thank you. Great organisation. Can you explain more about the digital platform? Yeah. So this is really I'm going to ask David to do that, because he's the expert in this space, and it's really in the ideation phase right now. But David, do you want to say a bit about that?
Yeah, it's through the prototype we'll learn more, but essentially the Huplo platform will allow the primary parents to actually register and input data which they're comfortable with sharing. But essentially the shift from the traditional method is that they will own that information, and then it's up to that primary parent to then share that with any chosen services, whether that be an early childhood education service or a family support service or one of the community services. So these various referral paths we'll be working through on the prototype, but essentially it allows that parent to own their own information, link it with connected services, and at any time they can choose to unlink that as well. So they have total control over it, and it's giving them that ownership.
So we're really trying to switch the idea that you could the data belongs to the person, and that the person decides who has access to that information, and when they have access to that information. Of course, it's not instead of what's already collected, but the idea is that you tell your story once, you should be able to. Everyone else should be able to have access to that story at the level that you want them to have access to that information. And it's really helping to support the agency for people. As I say, it's really in the idea stage.
Thanks, Rachel. Rachel's just, it's a great idea about the parent owning their own story. And just on your previous question, there will definitely be a fact sheet available about the data security and storage. It's always the first question that gets asked. So yeah, we'll be able to provide that. In short, we're right over the data security privacy principles, regularly audited, and registered with the Australian government, various cloud storage policies.
Yeah. So I'm just going to go back to Jacqueline.
Yes, local storage in Sydney at multiple distributed locations as well for data disaster recovery purposes.
So Jacqueline, so you're not sure whether I've answered your question. I think we're not actually sure how it's going to operate, except to say that we're talking with Leonie, engaging with Leonie, and we want to make sure that whatever work you're doing can connect with whatever work we're doing, and vice versa, where it's appropriate. And we also want to make sure that we don't overlap or duplicate the work that you're already doing. There's no point doing that at all. So it's really about where can we connect, and where is it useful for us to connect, and where is it useful for us not to, I guess. So yeah, the solution I'm hoping will emerge through the conversation between ourselves and your team. Okay. I'm just going to wait to see if there's any other questions. Okay.
Oh, sorry, I'll just scroll down. Sarah Robbins asked, sorry, can you repeat who you work for? Thanks, Sarah, Health and North Coast. So I'm the CEO of Hupalo. We're a platform that aims to connect parents to services and government. So we currently do that by means of 4 separate programs right now: administration-based program, healthy eating program, child protection program, and education program. And we're partnering with Healthy Australia to provide the technical piece. So in that slide you saw before, that very first piece, where the primary parent first enters into the Thriving Together Collective, and then from there can navigate through the different pathways. Leonie's asked, is the data platform linked with My Health Record? I'd love to say it is, but unfortunately there's not an API, so there's not essentially an integration available at the moment with My Health Record. But if there was to become one available, we'd most definitely do it. Likewise with Medicare for immunisation records and items like that.
Okay, thanks, Sarah. I'll just give it another 30 seconds to see if there's any more questions.
There's one from Rachel, actually. Are you hoping to engage GPs in this initial stage?
Yes, I was hoping there may well be GPs on this call. If you're a GP, yell out. But the idea actually came from Julie Sturgis to run this webinar for GPs and for community and for providers in the Clarence Valley. And so we promoted this through their newsletter. We've recorded this so that we can make this available to GPs and others, but we'll also be connecting with GPs through primary care and community services and the primary health network. We think the GP space is a really good opportunity for us to really identify which families could benefit from this program. So, for example, if you've got a family that's struggling, doesn't have much money, and we think that accessing an early childhood education service would be good for them, then we'd look at maybe some sort of scholarship for that child or for those children into a service. So there are ways for us to partner with GPs in that space. We also had a conversation with Norman Swan about this particular issue, and he also said GPs are really good at doing GP stuff and medical stuff, and they know when families are struggling, but they often don't know what to do about that. And if we could provide some route for them to provide access to a referral route that could really support that early intervention, then that would be something that would benefit GPs.
Jacqueline Noble, is Hupelo a private organisation or government somehow? So Hupelo is a private organisation, but we link with government. So we link with Centrelink, Services Australia, Department of Education, to provide certain data back to parents, such as their eligibility for childcare subsidy, absences, whether they're getting various sorts of additional childcare subsidy. It all feeds through to the system, so they've got that linkage there. But Hupelo is a private organisation.
And do you have some minimum numbers of families, etc., to develop meaningful data? It's not for the prototype. It will only be a handful of families for a reason. I think we want to keep it really small. But when we test the pilot, we will have to really think about the scale of that prototype in order for us to measure the outcomes. So what we want to do for the prototype is really see operationally, does this fit? Does it work? Where's the operational kinks? How do we iron that out? What's the system doing now, and where can we best support the system? But for the pilot, we'll be looking at a much wider population so that we can get some results. And FAMS they're specialised in results-based accountability work. So we will be doing that. We'll be looking at measuring the results, the outcomes, the processes, and the incomes and the funding, so that we're able to demonstrate impact.
Sarah, oh, sorry.
Yeah.
Level of connection sounds hopeful for potential link to My Health Record. This will significantly support ability to integrate with GPs.
Yeah,
absolutely.
Agreed. Yeah, so the prototype starts in September, the first week of September, and it will be a gradual. It'll be a very slow launch. We've got 8 weeks to test some of the ideas that we've got. So that will be, I think it's the Tuesday, the 1st September. The pilot, that will depend very much on the report from the November report. And we'll be aiming to, if all things work, aiming to run that from February next year. COVID obviously is a constraint to a certain extent, although we think that COVID in itself is creating a risk for children. So we would like to get in there to really support families during this time. Yes, Kim, we will be engaging them, and that we've been asked this question a few times, and we will be doing that over the course of the 8 weeks, and we will be getting advice on how best to engage the Medical Aboriginal Corporation up there. Great questions, by the way. Thank you. I'll just see if there's any more before closing off. Okay.
One more from Kim.
Ah, great, great.
The impact of Serco on the area.
So, Serco, I don't know what Serco is. I should do, I guess. Can you spell out what Serco means, Kim? Ah, yeah. So, yes. So what Julie talked to me about this, and there's going to be, I think, 300 women at the correctional centre as well. And one of the clear adverse child experiences, of course, is having a parent in the correctional facility, and the support that's needed from parents that are coming out of correctional centres. Now, of course, not everyone's going to be coming out in and out from Grafton or the Clarence Valley from that unit, but we are thinking about how we best connect with the correctional centre. Yes, associated, right. Okay. Shine for Kids as a contract to deliver services. Oh, that would be awesome, Leonie. Thank you. Yeah, please do. Okay. So look, I think that might be the end. We'll keep an eye on it, but that might be the end of the Q&A. Now, I'm going to give you my email address so that if you do have any follow-up questions, really happy for you to email me directly. Also, if there's people in your network that you want to tell about this program and they want to talk to me about it as well, please ask them to email me direct to my email address, which I'll probably write down under chat so it's there for people, is eugene at healthyaustralia.org. And I'll also give you my mobile number. Is there, so please don't hesitate to contact me either through email or mobile text, whatever works for you guys.
Just for the call, Eugene at healthyaustralia.org.
Thank you. Thanks, Leonie. Yeah, I'll see you in a couple of weeks. I'll be in touch with the logistics. I'll probably end up driving up there, I think. It's not far, is it? Okay. All right, guys. Well, look, thank you very much for attending the webinar. As I say, please contact me if there's any other questions. Also, if you've got ideas that we haven't captured, or you think something's not going to work, or have we thought about a different way of doing things, please let us know. I mean, we're not experts by any means. Yeah, so I cannot see that email. Oh, it's in the chat. If you go to the chat, Jacqueline, you'll see it there. But I'll say it again. It's Eugene, E-U-G-E-N-E, at healthyaustralia.org. And finally, just to say that this has been recorded. So as you've registered, you have access to the recording. You can look at it again. And if you want to tell people about the webinar, please let them know, and they can register and they can look at the webinar themselves. Okay. All right. Well, thank you very much for that. And thank you for attending, and thank you for your questions. Look forward to hearing from you soon. See you guys.
Good night. Bye-bye.
Bye.